It's a very good afternoon and welcome to the National AIDS Council COVID-19 HIV and AIDS webinars. For the next 20 days, we are going to be bringing you these discussions where we would want to really go into detail and discuss how COVID-19 and HIV do meet. We do know as a country, we join the world in working towards achieving the 2030 targets, where we are looking at ending AIDS. And as we're talking about ending AIDS, we do know COVID-19 came in and ravaged our countries, our communities, the world over. But what we should not forget is making sure that we do not reverse the gains that we have achieved as a country. We should continue remaining on target and not forgetting that as much as we want to tackle COVID-19, we still need to make sure that our commitments when it comes to HIV and AIDS are still on target. So today we are looking at what people with disabilities need to know about COVID-19 vaccination. Helping us to discuss this particular issue on this webinar, we have Ms. Madeleine Dube. She is Director of Communication within the National AIDS Council. We also have Agnes Jindimba, who is a deaf woman included director. On the webinar as well, we have Martin Renona, who is a deaf interpreter and a sign language lecturer. So ladies, gents, welcome to our first webinar.
Thank you. Thank you, Tarira.
Yes, Ms. Dube, I would want to start with you. Maybe for you to unpack for us why this webinar, why the National AIDS Council has really thought it's important that we do look at COVID-19 and HIV webinars for the next 20 days.
Thank you, Tarira. Thank you, our viewers, and everyone else who is listening at this particular time. We thank God for the opportunity given unto us. When COVID-19 came in, we started hearing that is happening in China, now some countries in Africa, and finally it hit Zimbabwe. And when it did, there was great panic among us as a nation and as communities, and not everyone had enough information. So last year we did some videos talking to issues of HIV and COVID. We moved on also to do a World AIDS Day under the precautionary measures on COVID, where we just had a few people in a hotel, and we had a lot of live streaming. We had also live coverage from radio stations, and we still realized that there are still gaps when we talk about HIV and when we talk about COVID. We managed to share that information, but during our dealings, you realize that we were one of the organizations which had translations into sign language, because there was an outcry that our community of people who are deaf are not receiving information. But during that period, as National AIDS Council, we tried a lot to share the information. But even up to today, there are still a lot of gaps, a lot of information which people need to know. When we talk about COVID, like I said, there's that great panic, and then people think that COVID-19 is overtaking HIV. You will realize that we are more than 30 years into this into HIV pandemic, but still there are issues. We have about 1.2 million people who are HIV positive. We still have 100 to reach out there. So most of these people, they are on treatment, but what we are seeing according to reports is that they are dying. We have about 20,000 people dying every year while they are on treatment. So as National AIDS Council, we are concerned to do our research and find out what is then causing people to die when they are on treatment. If you look at that number, if we say 20,000 people died last year, and then you divide it by months, and you see that almost about 1.7 thousand people died or die every month. When we look at COVID, we are not even 1.7. There is great panic because of how it's transmitted. and that we also don't know a lot of information. So we feel strongly that this particular community, they are a strategic partner if we are going to achieve our 90. We have achieved the 90-90, but the 95-95-95 by 2025, it's critical. And it's critical that also they don't suffer COVID. They're not infected with COVID. How do we do it? Is to share the information. We also want to find out from them what they would like to know, so that we can get the correct information for them and share it with them. You realize
HIV and AIDS for the next
there we go. My apologies.
Yes.
What we realized last year when we were doing our videos is that when we are talking about masking up, those who are deaf, they also need specialized mask. So you saw us as National AIDS Council that we did masks, transparent masks, and gave it to them. There were only a few. There were only 5,000. We wish, if we had resources, to do more, because according to the explanation we then got from this community, is that the transparent masks are not for them only. They also need to read our lips. So it's important that we have this specialized mask for everyone in Zimbabwe, because you cannot ask the next person when you meet them to say, are you able to speak? Can I hear you? How are you communicating? It's not easy. So, but if we all have the same, it means that we are on the same level. Then we can talk to each other, and they can hear us, and we can also hear them. So I'm learning from Mr. Mapeta the few signs as we communicate, as they help us translate into sign language. So for the next 20 weeks, we're hoping that what we are going to share today, what the community is going to share with us today about the information gaps, will help us program, filter those issues in there, so that they're not left behind. We don't need to leave anyone behind. So for the moment, I'll stop here.
Okay. Agnes, I would want to come to you and really to say, for the benefit of this discussion, maybe as someone with a disability, could you unpack for our viewers, when we are talking about disability, what exactly is it?
Thank you very much. So for myself and also for people with disabilities, we use the United Nations Convention on the Rights of Persons with Disabilities, and it says for disability, it's actually somebody with a long-term mental or physical or maybe sensory impairment. And this impairment, so this impairment, it actually interacts with some barriers in the communities. For example, maybe if you're a deaf person and there is no interpretation, it means that that's a barrier, because there is no interpretation and it's a barrier for you. But if an interpreter is there, it means that you are included. There is no barrier. We've broken those barriers. And also, if I see my sister who is here also, who is in a wheelchair, and it means that if she doesn't have the wheelchair, sometimes it becomes difficult for her to travel, because it's an aid for her. So without that, it becomes a barrier. And these barriers, they work together to exclude persons with disabilities in different lives, and they also limit them within their communities. So they limit them. So the impairment doesn't limit you, but it's the barriers that limits them in their communities. So if maybe I have something that I want to do in my community, but for people, they say for the disability, maybe you are deaf, people would think that, oh, this one is deaf, she's stupid, she doesn't know anything, she's dumb. But if you ask me in an appropriate way, then you can understand what I have to say. Because I remember before when I was actually in a shop, and then people were saying, oh, you are saying you're deaf, but you're clever, why are you lying to us? Does it mean that people who are deaf, they need to be stupid, they need not to know anything? No, it doesn't mean that, because people, they think that if you have a disability, you can't be beautiful, you have to be ugly, you have to be poor, you have to be in a sorry state. And they'll say, you are beautiful, you are a woman and you're in a wheelchair. How is that even possible? Being in a disability, having a disability doesn't mean that you can't be beautiful, you can't also do other things, because also the disability is a long-term impairment, but it doesn't limit you. It's the barriers in the communities that limit persons with disabilities in their lives. So if maybe, for example, we have a building and there is no elevator in that building, it means my sister who uses a wheelchair will not be able to access meetings that are held maybe at the first floor or other floors. That's a barrier for her in terms of participation. And then you'd have people actually lifting her, but that's abuse. Because imagine men, strangers lifting you and you don't know these people and they start touching you inappropriately. That's a barrier for you in terms of participation. Thank you.
Thank you very much, Agnes, for really unpacking that. And one thing that I would want to find out from you, I remember interviewing somebody for one discussion, and what that person said was, the moment that that disability is removed, say for example, when you're talking about putting in or giving someone a wheelchair, or what Ms. Dube spoke about bringing in those masks, where you can actually read my lips, where people with disability often say, you are looking at us and thinking we are stupid, like what you said earlier on. And that person was saying, the moment that has been removed and I am able to actually do what every other person is doing, for me, I would feel comfortable not to be actually looked at as somebody with a disability, because that disability has been enabled. I want to hear your view on that.
So I can't say that the disability, it finishes or it gets finished when you give me the interpreter, but the interpreter, as an example, is an aid. So these are what we call reasonable accommodations. What do reasonable accommodation means? These, they actually adjustments that make sure that a person with a disability is able to access and also participate equally with others. So, for example, somebody in a wheelchair, and maybe we are in a meeting in an upstairs, and there's no elevator. So it means that, and some will say, let's have the office maybe at the down floor with the door, maybe which are white doors, and also with accessible toilets, so that she doesn't have to be lifted when she has to go to the bathroom, because actually that impacts on her dignity. So actually these reasonable accommodations, they give people a way and to control their lives. And you see that today, if people see me with Onai, my interpreter, and then sometimes they want to actually communicate through my interpreter, but the interpreter actually interprets for me. So she says what I will be feeling, she says what I have to say, but sometimes people will say, Onai, tell us how is Agnes feeling, but how will Onai know how I feel? Because Onai will just be interpreting for me. Onai, what she does is to communicate what I tell her to say, but she doesn't know what the challenges that I face or my experiences. You have to ask Agnes directly, say, Agnes, what is your experience? Because our lives are different, but people will think that if you have read theory about disability, then you are an expert, then you know everything about disability. Yes, you might know the theory, but for myself, it's the experience that matters. It's the daily lives that matters, and not just theory, but the lived experiences are quite important in identifying disability. And also because they actually show some of the challenges that we have, and also some people, they would say, oh, don't employ a person with a disability because they're expensive. They'll need an interpreter, they'll need a guide, they'll need wheelchair adjustments. They're very expensive. But no, it's actually reasonable accommodations that we give that needs to be budgeted for within our programming. Because if you invite me, and then if I come here and there's no interpreter, and people refuse to pay for the interpretation, it means I myself now have to take money out of my pocket and pay the interpreter. But it means that it's no longer free for me. What is free for somebody else might not be free, because I would not be having the interpretation. So it's important to have these reasonable accommodations, because they help us to have our dignity. And also in different other countries, they actually have interpretations. It's actually a highly paying job, and you don't find them just on the road. Like you find them through agents, and also they are recognized professions. And also, it's actually you have to be registered, you have to be licensed. It means that if you have an interpreter, you actually have professionals who help you communicate. And these are reasonable accommodations to make sure that I also access on an equal basis with other people, and I'm also free to participate, and it also gives me self-control in my life. Thank you.
Thank you very much, Agnes, for really enlightening us. Those reasonable accommodations that she has spoken to, we need to make sure that that's available to us. And for those who are watching us on Facebook, do invite others to follow us and give us your comments as well, contributions. I'm seeing there Florence Mudzingwa, who's also a person with disability, saying thank you for an important conversation. We would want to hear more of your contributions. Msindo Msonza are there saying I am following, so do invite other people to join us to this important conversation. Martin, I would want to come to you and say the advent of COVID-19 and then people living with HIV, how has been the situation? Have people been affected? Challenges that you have faced? First, give us in terms of how the situation has been. We do know it's a strong constituency, and we do know you would hear from your other colleagues. So just unpack for us how people with disability, COVID-19, how has it been?
Thank you very much. Now, people with disability, they have met a lot of challenges. For example, like what Agnes was talking about, the various examples that the deaf, others with visual impairment, others using wheelchairs, the various challenges that they had, they are varied and they're diverse. And I also am deaf. What challenges did we face? First of all, there's information. Information about COVID. A lot of it was coming, but for the deaf, there was small access. Why? Because I'm deaf, I can't hear. So many organizations, they were giving lots of information, which is mostly using voice, less written material, and because the deaf have got low level of education, most of them, they won't understand the information that is being disseminated. And there will be a lot of confusion in regards to COVID-19, as in now, how am I supposed to cope? So hence, that was challenge number one about COVID. Now, also about vaccination. Why vaccination? If I'm vaccinated, what are the challenges? But because I'm also deaf or have a disability, there's confusion as to information, and hence many are afraid and withdrawn in regards to that because of lack of information. But if there's information that is clear, there won't be any challenges. That was the big problem. What about also a person with a visual impairment? There wasn't any braille material. How will they read and understand? If I'm also deaf, give us information with interpreters which are able to follow about COVID and about HIV. All included together, if the information is done, it's able for me to understand, there won't be any challenge. And if there are any risks, what are they? If I'm vaccinated, what are the effects on my body? Will there be any more risk or what? Many are afraid about this, but they won't be if there is communication clearly. And then many organizations, they were leaving out people with disabilities. There was lack of support. Why? Because most of the information that was being spread is mostly for the hearing. They come and they get support. But a person with disability, there wasn't any support. Maybe it was minimal. They were told to wait. But the organizations that would help, there are few. Better if there was more assistance and support. Like, for example, deaf women included is trying level best to support the deaf women. First of all, they find the challenges, and then they spread information about COVID. So this is very important, so that they know a lot of information and we have more support for people with disabilities. I think that will be very important And if there is more information, and for me, it will remove fear from the people. And then if you ask them, come for vaccination for COVID, and you explain to them, are there any risks? And then people with HIV, if they have COVID, should they stop vaccination or what? There will be confusion. Why? Because of lack of information. But if there is interpretation, and then people learn how to interpret and explain with full information, we will have minimal challenges. So I wish if that would be done, then people with disabilities, if they have information, correct information, accurate information, they are equal with others without disability. Thank you.
Thank you very much, Martin, raising quite pertinent issues there. I actually remember someone who sent me a message today after seeing that this poster for this particular discussion, asking to say, so if someone is with a disability, can they be vaccinated? It's all those things that people do grapple with. And then put HIV there as well. Ms. Dube, quite a number of challenges that have been raised. I'll come to you later on to respond to some of the issues that Martin raised. But I would want to go to Agnes first and say, Agnes, when we are looking at any disease, usually it carries the face of a woman. And when COVID-19 came in, being a woman with a disability, what would you say are the challenges that were faced by women with disability?
Thank you very much for that question. So I will not just focus on women only, but I'll also add on what my brother Martin said before I start my presentation. Also, there was a lot of poverty and hunger within the disability community. And also you'd see that with the COVID-19 pandemic, we had a lot of challenges, and one of the huge challenges was hunger. And also before, people with disabilities, they used to vend and sell in town. And if you move in town, you'd see a lot of deaf people selling in town. And also they would have a lot of ideas in terms of business. But we see that we don't have like inclusive SMEs within our country. So you'd find people with disabilities selling in town. And I would know that maybe some of them, they would know that the best way is not to beg, but they would try to sell within the town so that they can also earn a living. But when the lockdown started in our country, everybody was at home. Then where do you get food? And some of them, they require tablets. For example, some of them, they're on arts, and then you don't have the tablets, and then you don't have the food. And sometimes you need different diets which go hand in hand with your medication. And sometimes you've got that specialized diet, and people, some of them, they've got chronic diseases, some have got like BP, sugar, and all different other, they need like their medication. And if I'm hungry, does it mean then how do I access my medication? Because I would need food for me to be able to access the medication. Because sometimes my own doctor will tell me that, you know, Agnes, your sugar is very low. You've got low sugar. And you know, if you have a low sugar, it means that you can even be in a coma. And it means that if a person has not eaten maybe for a long time and they have not even accessed food or any means of getting food, they are hungry. And it means that these people, they actually start maybe taking the wrong diets because they're just eating what they have, what they find within their own homes. That was a huge challenge, where to get food. And another challenge for women, when we focus on sexual and reproductive health and rights, and also because we know that people with disabilities, they also engage in sexual activities. And also sometimes we saw that with the COVID, there was actually a move away from SRHR towards other fighting the pandemic. And then we'd see that even getting tablets, getting family planning pills, it was difficult. I remember one of my friends who was saying, you know what, at home there is no peace with my husband, because my husband is every time demanding to have sex with me. But I'm telling him that I've run out of my contraceptives, and if I go to the clinic, where will I get the letter to say I need to go to the clinic to access this medication, to access the contraceptives? And sometimes to get the letter, the exemption letter, say I need to go to the clinic, it was difficult. And you know that before we used to get family planning pills for free, but sometimes you'd go to the clinics and then they'll tell you, oh, sorry, we don't have this medication today. Go and buy in the pharmacy. But in the pharmacies, they want, for example, $1 and you don't have that $1, that $1. And your husband is demanding to have sex with you, but you don't want to be pregnant because it's expensive to take care of the children and you're afraid of actually maybe dying from other diseases there. So there was a lot of violence within the homes as a result. And actually we saw an increase in the cases of violence, and would see that the cases of domestic violence, because sometimes, like I mentioned, that the husband as a result would maybe beat the wife and now start actually beating children. And also there was a lot of domestic violence because of this COVID-19 pandemic. And also some people, they forgot to say that women, they need the family plannings. Yes, we're in a pandemic, but they actually need the family planning pills because of these sexual rights. And people, they forget that people with disabilities, they also engage in sexual activities. And actually if we see that this was also a source of violence within the communities as a result of the COVID. And also you'd see that some people, because they're not selling their products, they actually had challenges paying their rentals. And you'd find some of them that end up being homeless, they'd end up actually staying in town, staying in designated areas because they didn't have money to pay the rentals. And you see with children with disabilities, we saw with the lockdowns, some schools, they were having online learnings, and because they were trying to actually promote education, but we saw that it promoted inequalities within the education, especially for children with disabilities. I'll give an example. They started radio lessons. I think, yeah, I remember we had radio lessons, but for me and also for deaf children, they never actually benefited from these radio lessons, because for me, I don't hear, then how do I benefit from this radio lesson? And also, like for me, I've never even bought a radio. And then after we finished the online learnings, if I bought a radio for my children, then I don't even know how a radio works. So it means that even my children were missing out because I couldn't even support them. And some people, they'll think that maybe they can access it from the TV, but without interpretation, then how can the online learning benefit deaf children or even children with disabilities? And some parents, we know that parents of children with disabilities, especially those who are deaf, some of them, they don't know sign language, and some of them, they actually don't even have the online platforms to be able to teach their children online. So it means that these children, they'll miss out a lot of information, they'll miss out a lot of learning. So there wasn't any education for children with disabilities, especially those in poor communities. Because also this education, we know that education empowers an individual. It gives us like a strong voice. Like for myself right now, I can represent myself because I've been to school, I've been educated, I'm able to stand for my rights. But without education, it will be a challenge. And also with the COVID, we had a lot of challenges, especially with our transport system. Before we used to have like different private transport providers, but now with the Zupco buses, we'd have the Zupco buses operating. But we know with these Zupco buses, and also sometimes the people there, they would not understand the needs of people with disabilities, especially if you want to access maybe the transport. Some of them, they are rude. Some of them, people, they would push you, and some of them, they would actually push us. It doesn't matter if you'll be caught in the commotion. It doesn't matter that you have a disability or you don't have a disability. And also sometimes people, they'll think maybe you just want to have a free transport, but also as a person with a disability, sometimes you want to also pay. So they'll start chasing you away, say, oh, they want free transport. So no, where will I get the profit if they actually come into my bus? And also if she has a wheelchair, if she comes into this bus, it means that she has taken space for another person because we need space for the wheelchair. So imagine if actually you have a disability, sometimes you need to pay also for your support workers, you need to pay for your aids that you use. So transport really was a challenge, it was a huge challenge. And also if you go to town, you'd see that we had a lot of challenges, especially for wheelchair users, because sometimes people, they would actually vend on the streets, and then it will be difficult for you to even move with your wheelchair. And sometimes if you maybe pass through their products and then you mistakenly crash on them, for example the tomatoes, they'll say pay, but maybe you don't have the money there. So there were a lot of challenges that were as a result of the pandemic.
Thank you very much, Agnes. Ms. Dube, I would want to come to you, your reaction to a number of the challenges that have been raised by our two representatives. We do know that when we are looking at the National AIDS Council, your mandate is HIV and AIDS. But looking at all the issues that they've raised, they actually cross-cut. So they are issues that have something that pertains to the National AIDS Council, and would want to know your reaction. You spoke about how you have actually produced masks, visible masks, but she spoke about issues of materials in Braille. When it comes to education, we've gone on to do online lessons, we've gone on to do radio lessons, all these issues, and forgetting people with disability.
Thank you so much, Tari. Thank you, Agnes. Thank you, Martin, for the issues which you have raised. Surely these issues are not for National AIDS Council alone. It's for us as a nation to look at them. I'm sure some people who are viewing this program were not aware that there are so many challenges for people living with disabilities. For example, just getting at a bus stop and somebody wants to board a bus, and they are in front, or they are trying to ask for assistance so that they can get in, and people pushing you out and elbowing you out and saying nasty things. It's very sad. It's only when we understand that we can appreciate what people with disabilities go through day by day. I don't think we will learn everything and be able to give solutions for today. But there was something which was raised by Martin in terms of vaccination. Those ones, I'm sure we'll have the medical people to come on the program and address that one, because I think issues differ by person, by station, by the health worker who are attending to you. In some places, people were saying, we're asking, do they take your temperature? Do they check your BP? Do they check your sugar before they can administer the jab? But this depends, like I'm saying, with the medical staff, with the station, what they are able to do. So that one will let the experts speak to it. Issues of poverty and hunger. This also we had for people living with HIV, where food was being distributed and maybe they were being discriminated, they were not being assisted. What we did was to then talk to our implementers, those World Food Program, the FAO, those who are doing the distributions, to say, can they make a deliberate move to identify people living with HIV and make special arrangements so that they can collect food. We used to have a program with the chiefs in the communities, Zundera Mambo. That was the idea, that they then have food in the communities, and those who can't, those who are sick, those have challenges, they can go to the chief to access some food. And maybe it's a different situation now, we need to access it and see how best we can. We have had a number of drought years, maybe they no longer have also the food, but now they're depending on what the donors are giving. And in some cases, what I've seen is, if it's in the rural areas, the distance is being traveled to collect the food. It's also very, very difficult for someone with disabilities. And you also have challenges in the urban setups, that urban poverty is reality. Because it's reality, I don't think people have found answers to that. We have had people, you have seen people do their small fields around in the urban settings, and then the municipality or the local authority, they just come cut the maize, which was giving somebody some hope that they were going to have food. All those things I think need to be addressed and say, how can we assist those who are in the urban settings? Some people lost their jobs during COVID, because of the precautionary measures, they lost their jobs. They were formally employed, they had a salary, but they woke up, they had no job. And maybe they have no plan B, or they have no strategy. How then do I feed my family when you just wake up and there's no food? It's understood the businessman has to close. If he's not making profit, he has to close. I heard of a certain sad story. The churches, the pastors, they're also getting their livelihood through the church, and the church was not meeting. So where do they get the money? They were also affected one way or the other. Those who are renting, they were also affected. So when you look at the community of people living with disability, I think it's something which we should mobilize or coordinate a meeting as National AIDS Council, bring everybody on board and say, here we have a community which we need to look after, and we need to come up with a strategy how we can assist. It's even difficult when you're the one living with disability, you're employed, and you woke up with no job. It's even difficult. How do you do it? When we come to the issues of sexual gender-based violence, this has been happening even to the ones we call normal. That somebody was telling us a story, was sharing with us. It was in Nash Central when we were doing a support visit as management, and we got to hear this man was actually confessing that where I was working, informal sector, it was closed. So there I was at home, and I was just looking at my wife. So what else could I do? I would just let's go into the bedroom. Let's go into the bedroom. But the woman is not used to it because it's too much. Because of that, it turns out to then be sexual gender-based violence. The man wants, but he wants not because he wants because he has nothing else to do. So he is thinking that maybe that will occupy me, not to think, not to be stressed. So all those things we need to speak to as a community. Issues of mental health as a nation, I don't think we speak to very much. We just see people and say, he's not well, he's mentally ill, and we leave. We don't interrogate, we don't try and assist, we just look from afar. And we think that they've been bewitched or whatever. But we need to address those issues, because I see it, even us, we have been locked down, seated at your home, being able to do other things. But that thinking that I'm not able to move around as I wish, as I want, I can't visit relatives. I remember when it started, I was thinking about my father. He doesn't live with me in Harare. I wanted to visit him. The issue now was, if I visit my father, am I not the one who is carrying the COVID to him? So how do I see him? But it would be said if I carried COVID to him. So what did I do? You stay. You just are communicating, maybe you're sending money for food and the like, but you desire to interact. So imagine, I'm now imagining somebody who is living with disability. We have to, first of all, you have a strategy to overcome some of the immediate needs which they have before they can even go out to assist their relatives. It's not easy. It's very sad that maybe when people thought about the online education, did somebody really think through about the children who are living with disabilities? It's not easy. We've heard so many stories, the children turning to drugs, turning to sex work. We have seen children, some of them, because the parents have been laid off, they feel that they need to stand on the gap, provide for the family. But how are they doing it? Is it legal? Is it right? And parents at times being so disempowered to the extent that they see their girls doing what is not right, but they can't stop them because they're saying they are the ones who are bringing the food. They are the ones who are assisting us. We are failing. Morally, we are failing as a nation. Where the things which used not to happen during our time is happening now. How do you allow your girl to be in a sexual relationship with an older man who is married At times you even know the family, but you keep quiet because you're hungry. Those are challenges which we are facing. So both ways we're trying to highlight the challenges which we have during this period of COVID in terms of HIV, that we may see that the gains which we had naturally made over the years, we may be losing them because of COVID-19. We are not engaging. I don't know. We need to engage in a debate, in a debate in communities, and say how has COVID affected us? How can we remedy this situation? Something which you spoke to, I think, mostly the issue of diets, food diets. We have NCDs. How then do I get checked? My blood pressure, how do I get checked? My sugar, how do I maintain that special diet which I used to have? The first lockdown, there were no vegetables in the market. There were no vegetables. It's just simple, the vegetables which we know, they were not there. Those vegetables, they play a great part in our diet and in our health. But if you don't have, how then do you supplement? It's another issue. So in another way, it has brought that awareness of Zimbabwe, that these herbs which we have, which are around us, can help us. It also, because this was the summer season, people tend to those because they were now available. And now that people have the benefit of the medicinal in those vegetables, people started looking at those. Mutsine and helps for those who have anemia. So people tend to those. For those who have headaches, people were trying to find out what can I take without necessarily going to the hospitals. Because there at the hospitals, some people were not being attended to. They were being set back, or they were being asked to go and have a COVID test before they can be attended to other issues which they are affecting them. So our discussion today is meant to start thinking, how can we engage? Seriously, how can we engage so that the communities benefit and they can also be assisted? People living with disabilities need to be assisted. I think we need to really engage seriously in various levels and say, how can we assist everyone so that we leave no one behind? We have spoken to those who have hearing impairments, but what about those who don't actually see? Because maybe they are hearing us, or when you are on radio, maybe you're on TV, but they are not seeing. So they are missing out also on another level. So in the groupings, in the various groupings, I like the passion which Agnes has, because we share a certain platform here, COVID-19, the Risky Communications Committee under Ministry of Health. She's very aggressive about issues to do with people with disabilities. She will really, she will not stop until she has made a point. So if we can get various groupings highlighting their needs and calling for attention, I think that will really, really help. So I really say I have touched on a few now issues, but we need to then say, what do we do after this program? Thank you.
Definitely, when it comes to issues of people with disability, there are quite a number of challenges that have been said, and like what Ms. Dube is saying, what we need to do is to continue amplifying our voices, and really it's important that every one of us, we do find a part to play to make sure that all these challenges are eventually addressed. Martin, I would want to come to you and find out, really, does being HIV positive put you at risk of contracting COVID-19?
Okay. Now, people with disabilities, they've got various challenges, as alluded before, which is more similar to those without. But my own understanding is, people with disability, there is a lot. So for people with disabilities now, if they have more support from various organizations, like those who support those with disabilities and those with disabilities, they come together and they support and they work together. I think that way it will create an equality. If these organizations work with the government together, various NGOs, and then they look at the challenges for people with disabilities and then try to help and alleviate, it will be easier on how to help people with disabilities and have a support system. So first is an investigation to find out what are the challenges first. If the challenges crop up, and then the organizations will now see how to amalgamate and work together. Just like what NAC is doing. And then we have focus areas, like they focus on HIV. The challenges on HIV people with disabilities like diet and medication. We come together, we support people with disabilities with those areas, and then it will be far much better to attain those goals. But if there is no support, very true, we will continue to have a prevailing challenge. Like people who are deaf, they have businesses. They have varied work, but now they don't have. Now, maybe there's little money that they're now getting. Where do they get the food? It becomes hard. The family at home, the children, they want food. They'll be asking. So, all the time, government together, you find out through the police, their things were being confiscated. And then, what happens now? But if there's support from the government and non-government organizations together, and there's more awareness, and there's more understanding, and then how to make equality and empowerment for people with disabilities. And also, there's need for people to have respect to the rights and responsibilities for these people. And then create ways of support for people with disabilities. I know that people with disabilities, others have got HIV, yes, I know. But what now needs to be done is for medication, there is for food. Those various challenges, there is lack of information, and hence more people are dying every year. What is the breakthrough point then? If there is more food and there is more education and more support and more amalgamation, and then we help to alleviate the lives of people with disability, and then it will be easier for them and have a better life in the future.
Thank you very much, Martin, for representing people who are actually with disability, and looking at some of the questions that they normally have. And there are quite a number of issues that they would still want to know. And like what Ms. Dube has alluded to, in future episodes to come, we will try and bring in medical practitioners to address some of the questions that we normally have, especially when it comes to COVID-19 vaccination, where we are then saying, if I'm living with HIV, can I be vaccinated? Which vaccine? People often have all these conspiracy theories that they have, and some people are actually not even uptaking COVID-19 vaccination because of all the false information that flows around. Drug interaction, is there any drug interaction between the COVID-19 vaccine and when I'm on my ARVs? It's all those issues that we are going to try and address in future as we continue with these webinars in the coming episodes. So as we wrap up our discussion for today, I'll start with Agnes, and then I'll go to Martin, then Ms. Dube, you will wrap up for us. But before coming to you, we have a comment there from Tichaona Nizwa. Tichaona says, thank you for bringing such an important conversation. I'm sure benefiting from the discussions that have transpired. And Florence Muzingwa said, well done, my sister Agnes Chindimba, you're a powerful force. So words of affirmation there to you, Agnes. Coming to you, Martin, as we wrap up, your final words to our viewers, but maybe before coming to you, we actually have a representative who is also with us, and being on a wheelchair. We were speaking about some people with disability on wheelchair, so maybe your reaction to some of the issues that have been raised, and really your own comments when it comes to COVID-19, HIV, and AIDS, as well as broadly looking at issues of people with disabilities and what they need to know regarding COVID-19 and vaccination. Over to you.
My name is Jet Mageza, and I'm a sign language interpreter. This issue of COVID and disability is quite challenging, because some of us doesn't know much about this, but slim and disability. And we also want to know if it's safe for us to get vaccinated. As for me, I'm in a wheelchair. I've got a condition which called osteogenesis imperfecta. Is it okay for me to go and get vaccinated? Thank you.
So definitely she is still raising those pertinent issues that I have said, where people with disability, they've got questions that they have for the medical practitioners, and definitely in future we are going to be bringing them so that they do address some of these issues that they have. I do know with COVID-19, when I'm with a disability, any side effects that I might face, it's all those issues that people have, where sometimes I can actually tell myself that I would rather just be comfortable the way I am, but when it comes, it hits. Does it affect me more than any other person? So we will continue discussing these issues in upcoming webinars, so make sure you do tune in every day for the next coming days, where we will be exploring all these issues. So Martin, I'm coming to you as we wrap up your final words.
Thank you very much for this wonderful webinar. Why do I say that? It makes a lot of people with disability have a clear awareness, and also makes people link up with NGOs and the government to have a support system on how to help people with disabilities. So these meetings are very important, so that we know about COVID information and how it affects health, about vaccination. Is it good or bad? How does it help me as a person to have vaccination? How does it affect my future? And have clarity on health issues. So I'm very thankful, and I hope that in the upcoming webinars we have more information. And now that we have these programs, they should keep on continuing and have more work, while we need more information to be disseminated, and we are at equal access for people with disabilities and those without. So it's very important. Secondly, also the issue of medication and vaccination. How does it come about, and support for women and girls with disabilities? And so to NAC, I'm very happy, because for me that should have been the first time to have such an interactive approach on how people with disabilities. And I'm so very happy, and I thank God for making this possible, to have a time where we have an open discussion on ways to help others. But if there is no communication of such, how then are people with disabilities helped? It's difficult. So, to all the members, to the NAC board and all those who planned this program, thank you very much for these dialogues, and I'm very helpful. Thank you very much.
Thank you very much, Martin, and thank you for appreciating the efforts that have been put in place by the National AIDS Council to really look at these issues, where we do know COVID-19 is with us, HIV has been with us for 30 30 plus years, and we do not want to reverse the gains because COVID-19 has come. What we need to do is to find ways of how we can really address the two different viruses, COVID-19, HIV, and make sure that there is none that impacts on the other. We do address them, even if when it comes to issues of funding that's been availed to HIV and AIDS, we do not have situations where we are then saying maybe let's move HIV funding to COVID-19. We need to make sure that none of the two actually lags behind. I'm seeing when it comes to vaccination, Florence Mudzingwa says, I am physically challenged and have been vaccinated the first and second jab. So it's good to be actually getting someone who is physically challenged, alluding to the fact that they have been vaccinated, they didn't have any side effects. So quite important information there that we are getting. Agnes, coming to you, your final words as we wrap up our discussion.
So for me, I'm not a doctor, but I will say what I think myself. I think it's best if, for example, somebody has been vaccinated, maybe also give maybe a percentage, also a percentage for people with disabilities, and also give it those who can also support others, and also explain what the vaccination means to them, because we've been having the conspiracy theories, people actually saying, you know, this COVID maybe is from America, they want to exterminate people, they want to kill us all. So people have been saying a lot of things about the vaccines, but if we have people who have been vaccinated actually sharing their stories, it's important. And also it's important that when we see to say, maybe is it good for me, is it not good for me, and then people have to know the benefits and also some of the disadvantages. So for me, myself, I actually suffer from diabetes, sugar diabetes, but I've got a friend of mine, Nyasha Sengai, who's also diabetic, who said, oh, do you know what, Agnes, I've actually finished, I've had my first jab and my second one. And then I said, but you've got, you're diabetic. So I actually had to debate amongst myself, and then later I went to be vaccinated and I didn't have any side effects. So people are different. And people have got different views when it comes to the vaccination. And also for me, and like for the vaccinations, there are some people maybe who would say this vaccination is just like with yellow fever. Some would have maybe side effects, some would not have side effects, because people, their bodies, they are different. So it's important for the person to actually have the full information, because some of us, we got vaccinated, we didn't get sick, and also had the second, yet to have the second jab. So I'm not sure, maybe some of them because they have like side effects, but very mild of them, and some of them they've got different side effects. So it's important to have actually full information, and also it's important for people to understand, because in Zimbabwe, you'd have the government saying maybe the lockdown has come to an end. People would think that it means that COVID is actually also come to an end. But no, we still have the virus, we still have the COVID pandemic. And also you'd see some of the people, they're even wrongly wearing the masks, and some of them, they're no longer following the guidelines, because they're saying, well, we no longer have the lockdowns. Because some of them, they'd also have the attitude to say, well, if I have the virus, then I wouldn't want to suffer alone. So it's easier for us to suffer together. So they would ignore the guidelines, because they would think that it's important, it's actually good that we suffer together, which is actually wrong. And some people would think that maybe if you have the vaccine, maybe you would also start being sick from other things. But also it's important, because people would think that if the lockdown is finished, then it means that, well, we are free to do what we want, because there is no longer exemptions, there is no longer need for the police to actually on the roads. So it means that, well, we don't have to follow all these guidelines, but we don't need somebody to actually be controlling you, because we know the effects and the impacts of the pandemic. So let's make sure we are all safe, and let's make sure that everybody is safe within our communities, because we have got people with disabilities, we have people who are old, we have people others, we need to think about when we actually fail to follow these guidelines. So we are responsible for each other in our communities. So we must also learn how to protect each other as a community. It's very important not just to be selfish, say, oh well, I don't mind, but let's think about the next person. I think it's very important. So thank you, NAC, for this webinar. And also thank you for creating an inclusive way and having deaf people and other people with disabilities within your spaces and also other organizations. It's important that we work together so that we create an inclusive environment, people with disabilities, the government, so that we all develop and we all are empowered. So I'm actually happy to say that we have come together here, because sometimes if you just give charity, if you give somebody, let's say, sugar today, they would come again tomorrow. But if you don't empower them, it means they would come back. But we as people with disabilities do not want the charity. We want to be empowered so that we can stand for ourselves. Because if you give me clothes, let's say today, I'll say, maybe this person doesn't even care for me. Why would they give me things like this? But if you maybe give for myself, let's say maybe you give myself the right and also the choice, it actually is important for me. So please, let's empower people with disabilities in our community. It's quite important not to just give them charity, but to also give them the opportunity to represent themselves, to do what they want. It's quite important to create an inclusive space. Thank you very much.
Thank you very much, Agnes. I could see the passion, and indeed in sign language I'm seeing you go like this. Thank you very much. Key points that Agnes has raised is the issue of us making sure that we adhere to the COVID-19 protocols. Definitely as a country, I think somewhere, somehow, we are relaxing. I witnessed the last weekend just seeing on social media the amount of parties where people were just celebrating, and bulk of us not wearing a mask. Definitely would not want third wave coming. So it's important, like what she has said, it's always important to know that the action that I'm taking today, am I protecting myself? And at the same time, am I protecting another person? Am I protecting my family? So it's always important that we adhere to the COVID-19 protocols, particularly the prevention protocols. Ms. Dube, as we wrap up, what can we look forward in the coming 19 webinars?
Like I have said, we have taken note of what our colleagues have said in this particular program. I'm having this feeling that maybe we should have someone with disabilities in all the programs, so that people, when they discuss, they can interrogate the things pertaining to people living with disabilities, so that we are not speaking on their behalf, but they speak for themselves. So we'll create that platform that in all the programs they will be included. So brace up, Agnes and Martin. Maybe you'll be the ones coming, I don't know. Maybe you'll find other people to come. But it will be good that the same issues which you have raised, when we talk about vaccination, you raise them again. We have heard them, but we need to hear them again. What I didn't highlight is that as National AIDS Council, we realized that leaving one behind means also to train people in sign language so that they can assist at health facilities. So we had peer educators trained in sign language so that they can assist with the health workers whenever someone with disabilities visit and they want to know more about HIV. So we are grateful that Sunrise has assisted us to train people. When COVID started, we actually shared the names of these people with the health workers to say they are in these areas. If you can access them or invite them to the health facilities so that they can assist the health workers, that will help. Because I foresee a situation, maybe now things have changed. We foresaw a situation whereby somebody with disability or who is deaf, they get to a facility and say, I want a COVID test. And how do they communicate? So having someone who can interpret helps a lot. We realize that for us to prevent ourselves from COVID, we need to wear the mask all the time, social distancing, and also washing our hands all the time, or sanitizing with the sanitizer which is about 70% alcohol. The same, we still go back to the issues of HIV prevention. The first one which Dr. Parry would say is prevention, second one prevention, the third one is prevention. So in this case, what do we need to do? If you can, abstain from sex. If you can't protect yourself by wearing a condom, use a female condom or a male condom, but don't use both. Okay? So if we're able to, we're saying, if we're able to put on the mask like this and endure, we can definitely not forget to put on a condom when we want to do the act outside the normal relationship. Takati kwese kupfeka mask kana condom kwese kupfeka, saka ngati strategize kuti tinopfeka sei so that you protect yourself. You can protect yourself from COVID, but when you get HIV, it's another story because you'll be on treatment for the rest of your life. Just imagine, some of us even struggle taking BP tablets every day. Unozofunga the following day andina kana twakunzwa msoro kuti amsoro kutema andakagumsira rini kumwa mapirizi. So we don't want that. We really want people to be conscious of their behavior. You are in charge of your behavior. You're being in charge also has results, either positive or negative. Then the last one, which we normally don't talk to, is being a brother's keeper. That you just call someone you know, whom you haven't spoken to or whom you haven't visited. Just give them a call. At times we sit there at home, you are alone and the phone is not ringing. You are looking at the phone wishing somebody would talk to you. No one is talking to you. So it will be good being a brother's keeper. Call someone and say, how are you? I just thought about you. Please mask up. They will laugh a little, but that reminder makes them be confident that what they're doing the right thing. Avoid spaces. When you spoke about those parties, we used to talk about the young ones, the youth doing parties. But what I saw, the big women and the big men, not even properly dressed. So what are they doing? What are they attracting? We know what they would do if they go to a party like that. So it means, then you want to ask them, do you have a condom in there? The little bag which you are carrying, does it have a condom? But these are the things which somebody must think about. Don't say, tapura COVID, jana ni mazwano, warigambo no far. But you forget the other pandemic that is still there. It has not died, it has not slowed down. We are fighting so that we end it by 2030. So I thank you very much for listening. Those who are listening, let's hear your comments so that we see how we can incorporate. It's not only the 20 programs we want to do. If we can, we want to continue until year end. Thank you.
Thank you very much, Ms. Dube. I think we go. Thank you. Powerful words there, and really the key message that I would want to leave you with. But before that, we are seeing the ZBC Sign Language Interpreter Susan Masona saying, well done, guys. So it's important. And to you, Susan, we are saying, indeed. So the key message that I would want to leave us with today is what Ms. Dube said. If we can put on a mask and endure, you can still put on a condom. Kwese kupeka. Until next week, next time, it's goodbye. Kwese kupeka.
Your views and comments are welcome on the program. Remember to like our Facebook page and our YouTube channel and be the first to see as it happens. Watching TV on the go. SlyMedia TV. Building bridges.